All right, you are not going to believe this story. We're about to dive into a real-life medical detective case, one that comes straight from the pages of the New England Journal of Medicine. We're going to follow the clues, piece together a really complex puzzle, and uncover not one, but two totally separate, life-threatening conditions in a single patient.
So, here's the big question right at the start. How does a simple sore jaw suddenly turn into a massive, dangerous swelling in the neck? It seems like a straightforward complaint, but it spirals into something so much more serious. What's the hidden link here? Let's get into it.
Okay, so let's meet our patient. She's an 86-year-old woman living a pretty independent life, but she does have a few chronic health issues. Now, the one detail you really need to file away is this. She has end-stage kidney disease. That means she's on hemodialysis 3 times a week. Trust me, that little fact is going to become a huge piece of the puzzle later on.
Just look at how fast things went downhill. 1 week ago, she was fine, just a routine checkup. Then, 4 days ago, the jaw pain starts, and now she's in the ER because the pain is so bad she can barely eat or drink. This kind of rapid progression is a massive red flag. It tells the doctors they're not dealing with something slow and simple. This is aggressive, and they need answers, like yesterday.
So, with the patient now in the emergency department, the medical team switches into full-on detective mode. And just like any good investigation, it all starts with gathering that initial evidence, a thorough physical exam and some really critical lab tests.
The physical exam turns up a whole bunch of clues. First, the obvious one, this big, painful mass in her neck. But then things get weird. The doctors hear a strange whooshing sound in her arteries. And then there are these other findings that seem totally unrelated, a swollen, tender knee and this firm lump on her thigh. So the question is, are these all connected? Or are some of these just red herrings, meant to throw everyone off track?
And here's our first hard piece of data. This number, 11,540, that's her white blood cell count. Now, a normal count is usually under 11,000, so hers is elevated. This is basically the body's fire alarm screaming that there's a serious infection or some major inflammation going on. This lab test confirms it. Something is very, very wrong.
This is the first huge breakthrough. An ultrasound of her neck shows exactly where the mass is coming from. It's not just swollen tissue, it's a dangerous bulge coming from the wall of her common carotid artery, the main pipeline that sends blood up to her brain. This is an absolutely critical, life-threatening discovery.
So, what in the world is a pseudoaneurysm? Okay, think of it like this. A true aneurysm is like a weak spot on a tire that bulges out, but the tire wall is still intact. A pseudoaneurysm is way scarier. It's like the tire has a puncture, and the only thing holding the air in is the flimsy outer rubber. It's a leak, a hole, with blood pooling outside the artery, held in by nothing but soft tissue. It's incredibly unstable and could burst at any moment.
Okay, with all these clues on the table, let's take a quick step back and kind of pull back the curtain on how doctors think. How do they even begin to approach a case this complicated, especially when it involves an older patient with a bunch of other health problems? It's not just about the disease, it's about the whole person.
For older patients, clinicians often use what's called the 4Ms framework. It stands for mentation, medications, mobility, and what matters. For her, you can see her new knee pain had totally wrecked her mobility. And most importantly, they had to figure out what matters to her. What were her goals? What did she want for her own care? You have to understand that before you can treat anything else. All right, now for the list of suspects, what doctors call the differential diagnosis. They had a few top theories. Could this be a massive, deep infection burrowed into her neck? Or maybe an autoimmune disease where her own body was attacking her blood vessels? What about something related to her kidney disease? Or was this just a really nasty complication of her existing vascular problems? Pretty quickly, infection rose to the top of that list. And this is where that one crucial clue, her kidney disease, comes roaring back. See, hemodialysis means there's a port or a catheter that gives constant access to our bloodstream. And every single treatment is a potential open door for bacteria to sneak in.
Okay, the investigation phase is officially over. The clock is ticking, the patient is getting sicker, and the team has to move from just thinking to doing. This is the turning point, right here, where this medical mystery starts to get solved.
And this is where things get really intense. New scans show that the pseudoaneurysm is actually getting bigger. If that carotid artery ruptures, it's catastrophic. Game over. So there's no more time to wait. The only choice is to go into immediate, incredibly high-risk surgery.
So, in the operating room, the surgeons go in and they carefully remove that whole damaged section of the artery. And this is the moment of truth. They take a piece of that tissue and send it straight to the pathology lab. The final answer, the real culprit, is going to be found under a microscope.
And here it is. This is the smoking gun. The report from the lab describes an abscess, a pocket of pus filled with the immune system's first responder cells. And, most importantly, it shows clusters of gram-positive cocci. In plain English, that means bacteria. The neck mass wasn't just a weak blood vessel. It was an active, raging infection.
So the final diagnosis for the neck is an infected pseudoaneurysm. The bad guy was Staphylococcus aureus, a really common but nasty bug. It somehow got into her bloodstream, set up camp in the artery wall, weakened it, created an abscess, and caused that life-threatening leak. Mystery number 1, solved.
But wait, just when you think the case is closed, we're not done yet. Remember that other clue from way back in the physical exam, that firm mass on her thigh? Now that the immediate danger is over, it was time to circle back and solve this second mystery.
Now, this lump had been there for over 10 years. Everyone just assumed it was a simple, harmless fatty tumor called a lipoma. But here's the catch. It had recently started to grow. And when they did new imaging, they saw it wasn't just a simple ball of fat anymore. It had all this complex structure inside it that made the doctors pretty nervous.
And this really shows you the difference. On one hand, you have a benign lipoma. It's simple, slow-growing, totally harmless. But on the other hand, what she actually had was an atypical lipomatous tumor. Now, this thing is different. It very rarely spreads to other parts of the body, but it is locally aggressive. That means it wants to grow and invade all the tissue around it.
So, there we have it. The second diagnosis is confirmed. The really good news here is that even though this is technically a very low-grade cancer, for this specific type of tumor, a complete surgical removal is the cure. You get it all out and the problem is solved.
So let's just step back and wrap this whole thing up. We started with one patient and what looked like one problem, but what we ended up with were two totally separate, incredibly serious diagnoses. It's just wild. And you know what? Against all the odds, this story has a fantastic outcome. The infected artery was repaired, and she got weeks of antibiotics to clear the infection. The tumor was completely removed in a different surgery, and incredibly, she recovered fully from both of them, got back to her life, and lived for another 5 years before passing away from something totally unrelated.
And that leaves us with this final, really interesting thought. In medicine, there's a principle called Occam's razor, where doctors are taught to look for the one single diagnosis that explains everything. But this case just shatters that idea. It proves that in complex, older patients, sometimes there isn't just one simple answer. Sometimes what you think is a red herring isn't a red herring at all. It's a whole other fire you have to put out.